Welcome to the Encinitas Chamber Chat Live podcast. I'm Carol Knight with the Encinitas Chamber of Commerce. With the help from my talented friends at Max Deluxe, we will showcase the many aspects and unique qualities of the Encinitas community. Whether it be focusing on local business owners, advice from experts, or highlighting some of the local gems Encinitas has to offer, we hope you'll find this podcast informational and entertaining. As you may know, May is Mental Health Awareness Month, an ideal time to educate the public on treatments that can transform lives. I'm thrilled to have with me today Dr. Georgine Nanos, founder of Kind Health Group in Encinitas, to discuss innovative approaches to addressing mental health for long-term care with lasting results. More than just a physician, Dr. Nanos stands out as a visionary in the medical field, championing the transformative power of preventive health. She is driven by a passion for empowering individuals and encouraging them to take proactive measures in their healthcare journey. Please welcome Dr. Georgine Nanos. Thank you for being here today.
Thank you so much for having me, Carol. I'm so excited to be here.
We have so many topics to discuss.
We do.
It is May is Mental Health Awareness Month, but let's begin by your journey and your inspiration to start your business here in Encinitas.
Yeah, thank you. So I'm a family doctor. I've been practicing medicine in Encinitas for over 20 years now. I can't believe it. I started at North Coast Family Medical Group, which is a very popular establishment here
yes,
in
everyone has a connection to there.
Yeah. Yes, it was a wonderful place to practice for many, many years. But as I moved along in my career, I really wanted to spend a lot more time with my patients and really develop deeper connections. So I started Kind Health Group, which is a concierge primary care facility. And also at this point, we're also doing concierge dermatology, concierge psychiatry, and accelerated TMS. So our focus is really on spending time with people and giving them the space to be heard and be able to share their stories so we can really help them in the best possible way that we can.
All right, so the word concierge service or health service is, some people aren't familiar with that. Can you explain what that concept is?
Yeah, sure. So it's a membership model in addition to, I would say, in addition to, your standard the standard care you get at your primary care doctor, we also allow for a lot of extra time and access so that you can be seen immediately. We also help expedite referrals for patients. If you need to see a specialist, we can get you in very quickly within a few days as opposed to waiting months or weeks, as is often the case these days. Right. And then we also have a robust team of health coaches that are working with every patient on preventive care. So we focus on a more proactive approach to medicine. The traditional model of medicine is very reactive in that you only go to the doctor when you're sick. Mm-hmm. We want to see you all the time. Okay. And so we are focusing on keeping you from being sick. So we focus a lot on stress management, nutrition, exercise. We also give all of our patients Oura rings, and that's a great tracker for sleep and stress levels, HRV, heart rate variability, temperature. So we really go very deep into helping people stay healthy and focus on those preventive aspects of health. And our health coaches are meeting with our patients all the time. They'll take them for walks on the beach or a grocery store tour if they want to figure out what to eat. Mm-hmm. We'll even go to their homes and clean out their pantries and help them decide what to keep, what to toss. Mostly we toss everything, and especially the Oreos that are hidden way in the back. And so we are focused on really developing customized plans for all of our patients so we can meet their needs and we kind of meet them wherever they are on their health journey.
I love that because I have so many friends and who moved into the area and they're like, who's your primary care? I'm like, I don't have a primary care. I only go when I'm sick. So I don't really have a doctor that I've established a relationship with. So I like that approach where you're trying to make them not basically have to go to the doctor, right?
Yeah, we try to keep people out of the emergency room, out of the specialist's office. We try to really stay on top of all of their healthcare needs. In fact, every week our whole team meets every Monday, and we talk about every single patient in our practice, what's going on with them, what they need, what was happening last week, this week, what we can anticipate for the coming weeks for them. So we're really proactively, really involved in every detail of everyone's health that comes through our doors.
I love that, because you often hear about the team approach when someone is sick, if someone has cancer or something like that, some disease, but you don't often hear about that team supporting someone who is healthy and to keep them healthy.
Yeah, we love that approach. Our patients seem to love it, so we've had a lot of success with it. And it's a really enjoyable way to practice medicine. It's really restored the joy in medicine. A lot of doctors are very burned out right now by the current state of healthcare. They're seeing, one patient every 5 to 10 minutes and just really getting burned out. And that was what was happening to me, frankly. And I love practicing medicine. I love it with every fiber of my being. And I know I want to do it for the rest of my life. I just couldn't do it at that pace. And so this really allowed me to get that joy back and really feel like I have those deep connections with people and I'm making a real positive impact. So it's a really fun way to practice.
Oh, I love it. I love it. So I've had the pleasure of touring your facility. And it's just as soon as you walk in, I think you and I connected because it's the grays and the blues, and it just is really warm and welcoming, which is very opposite of when you go to a traditional doctor or medical building or whatever. So as soon as you step in the door, you feel a little bit more relaxed and welcome. So I appreciate that. But from that, you're touching so many aspects of someone's health, but you've really honed in on some mental health initiatives.
Yes. So I think what a lot of people don't realize is that 80% of mental health care in this country is delivered by primary care physicians, including OBGYNs. So most primary care doctors are their first access point for any mental health issue. So in our training as family doctors, we have a lot of extensive training in psychiatry and mental health issues. And by default, as a primary care doctor, when someone's struggling, they'll come to us with their physical complaints, but they also will have as often mental health issues. And it sometimes is, kind of at the last minute, at the end of the appointment, oh, by the way, I'm really depressed, and, whatever comes out of that. So most primary care doctors are very skilled in dealing with mental health issues. For me, it's been a particular focus of mine. I've loved being able to help people in that way throughout my entire career, so I'm very passionate about it. And as an extension of that, a few years ago, we brought TMS into our clinic, which is Transcranial Magnetic Stimulation, which we can talk about whenever you'd like.
Well, that's a good segue.
Yeah.
So I hadn't heard of that, and the acronym is TMS.
Yes.
Before I met you. And actually saw you did a mini demonstration for me, because there's a breadth and a depth of mental health issues, and obviously there's a breadth and a depth of treatments for that. So tell me a little bit what puts TMS different than what we would consider traditional treatments.
Yeah, so right now, most traditional treatments are limited to therapy, to talk therapy, and medications like SSRIs, antidepressants, Prozac, Lexapro, those kinds of drugs, which are very effective for a lot of people, and a lot of people do very well on them. But there's a good subset of people who either don't want to take them for whatever personal reasons, or can't take them, or haven't had a response to those therapies. And so for those people, and then, anyone who doesn't want to try that, that route, TMS is a really good option. So it stands for Transcranial Magnetic Stimulation. And as soon as I say that, my next words are always, it's not electric shock therapy, because everyone has that association, and it's entirely different. So TMS is a non-invasive device. It uses magnetic field energy to penetrate deep areas of the brain where our anxiety and depression centers lie. It's called our salience network. And oftentimes, I mean, for all of us as humans, if we're experiencing any sort of negative event or a challenge or a trauma that we've had in our lives, they can develop these well-worn, deep negative loops in our brain that we get stuck in. And a lot of times you can get unstuck out of it, but sometimes you can't, and that becomes the pathology of anxiety and depression. And so what the TMS device does is it uses these deep magnetic pulses to get into that salience network and create brand new positive neuronal connections in the brain, on the order of like 250,000 pulses to generate that. So it's a pretty intense treatment. And so this way, when you finish TMS, if you're faced with a challenge or a stressor, instead of going to those negative loops, you can go to those new positive connections that have been established through this concept of neuroplasticity, where the brain is building up these new connections. So it's a very revolutionary treatment. The great thing about it is that it has no long-term side effects, which is not something I can say about anything else in medicine. So for that alone, it's really exciting. And it is really the best treatment we have for anxiety and depression in medicine today. It's just not being applied enough. So the response rate for TMS is, for traditional TMS, is on the order of 60 to 70%. And in our clinic, it's 87%. Whereas for medications, it's a little bit lower, sometimes 40 to 50%. It's just that there hasn't been enough education about it in the general public, and there hasn't been enough access through insurance and other means to make people aware of this treatment. It's pretty remarkable.
So it sounds remarkable, but it must not be like a one and done. I mean, it must be a series of treatments.
Yes, exactly. It's actually, it takes 40 sessions to get to a therapeutic effect. So each session takes about 5 to 10 minutes. So the sessions themselves are super brief. The magnetic paddle is placed on the brain, and we map particular areas of the brain depending on what mental health disorder we're treating. We can also treat OCD, addiction, as well as PTSD, and a number of other mental health disorders. And those are all mapped to different areas of the brain. So you have the paddle placed on top of your skull, and then the pulses are delivered, feels like a little tapping, and it lasts about 5 to 10 minutes, but you have to do 40 of them. And so the traditional way, when this has been FDA approved for over 15 years now, when the FDA first approved it, they approved it in a 40-day protocol. So what happened was people had to come every single day for 40 consecutive days, which takes about 8 to 10 weeks to complete.
Big commitment.
Yeah, and it's a huge commitment. So outside of research institutions and university settings, people weren't really finishing this protocol, and they weren't seeing those results as quickly as they hoped they would. And so about 4 or 5 years ago at Stanford, a group of neuroscientists and psychiatrists came together to see if shortening that protocol would be as effective. Because you can imagine there was a lot of frustration in the psychiatric community, because this is literally the best option to treat depression, and no one's doing it. So the Stanford protocol came out of that trial, those series of trials, and that became known as the Stanford Accelerated or SAINT protocol for TMS. So instead of now doing it in 40 days, you can do it in 5 days. And what that means, you have to be doing it 8 times a day, and you have to rest the brain in between. So you're doing 8 hours a day for 5 days. And that's what we do at our clinic.
It also seems a little bit exhausting, but it's a much more obviously condensed schedule.
And so you can get the results much faster. I mean, we've had patients who have come to us on a Monday telling me, like, if this doesn't work, I'll be killing myself on Friday, which is an absolutely horrific thing to hear. And that's happened to us a handful of times, and we've been able to take them out of that suicidality and keep them in remission long term, like years now after the fact. And that is just an amazing thing to see, to witness, and to be able to help people in such a profound way has completely changed my entire direction of the course of my career. This is something I'm like deeply focused on.
Right. So I have 2 questions out of that. So are there a lot of the accelerated TMS programs around the country? Are you one of a handful?
So we're one of, I'd say, 3 that are delivering it at this level. I mean, we specialize in the accelerated protocol. Most of the TMS clinics are doing the extended protocol, and they will occasionally do accelerated treatments. We primarily do accelerated TMS in our office. There's a couple other clinics in the country that also specialize in it, but we're one of the top 3 right now, and we have these outstanding results because we also pair our health coaches with our TMS training, our TMS treatments. And so patients are getting health coaching in between the sessions and then afterwards for a full year. So we're in constant contact with them, kind of similar to our concierge model. We're very proactive on making sure that they're doing well and, getting their needs met after TMS and just really keeping a close eye on our patients to take good care of them. And we do that for a whole year afterwards, which no other TMS clinic does.
Right. All right. So your success is 80 whatever percent you said. Can you share some stories?
Absolutely. I can. I'm just trying to think of what kind of story. We have so many. Well, I can tell you the patient I was just describing earlier who came to me on a Monday. This was a 32-year-old transgender male who was really struggling and just deeply depressed, had been depressed his whole life, and really wasn't leaving the house, couldn't get a job, couldn't function, just really in a profound state of despair, had a few suicide attempts in the past and was really at the end of his rope and just felt like there was no hope left. And when he came to us, he really did tell me on that Monday, like, okay, I hope this works by Friday. And it was just absolutely heartbreaking. And then you can see over the course of the week, the way his mood transitioned. And the other thing too with TMS though is you get a lot of emotional ups and downs through that week. So what tends to happen is that any unprocessed trauma starts to come up to the surface. So it's really important when you're selecting a TMS clinic, if you're doing accelerated TMS, that they're really skilled in being able to deal with whatever is coming up during that week, because it can be very intense for people. We are fortunate to have an outstanding team at my practice. We have psychiatric experts as well as people who are very trained in suicide prevention and all the things that are needed to help best support people. And so there's a lot of up and down for the patients in that week. And then by Friday, it's not typical that you will see like that fast of a response. We like to see that happen, but it doesn't always happen that way. More commonly, you'll see a response, an incremental response over a couple of weeks and then a few months afterwards. But sometimes you will see that fast of a response. Unfortunately for this patient, he was able to really see like complete remission in 5 days, which is a little, not typical results, but still pretty dramatic for this person. And he was able to he bought a sailboat. He's like he's got a job in downtown San Diego. He has a romantic partner, and he's just like living his very best life and is so happy. And we're in touch all the time still. And he's just, he's our miracle. So,
oh my gosh!
And we have a lot of stories like that, and so that is just incredibly powerful and inspiring to me, and makes me want to get this out there to as many people as possible.
So that sort of leads me to my next question. So are people coming from near and far to you?
They are, yes. So they're coming from all over the country. We have people that have come out from the East Coast, from the Pacific Northwest, from Arizona, New Mexico, because we are able to really tailor the treatments to each individual. And the other thing too is that accelerated TMS is not covered by insurance, unfortunately. So that makes it a little more challenging for people to get access to it. But the nice thing about it is that we can treat some other disorders that are not necessarily on label covered by insurance. For example, PTSD, and then some anxiety disorders are not covered by insurance, as well as we can treat tinnitus and migraines with TMS as well, and nicotine addiction. And sometimes it's harder to get insurance coverage for those. So we also have treated autism spectrum disorders. Not that we're treating autism, but what we can do is help those patients be able to better emotionally regulate themselves so they can function better in society. So We have a great story of a autistic 23-year-old woman who was really struggling to figure out her way. She had gone to college and was just having a hard time managing, and she had done a treatment session with us. She was one of our first patients, actually, and now she's got a full-time job, and she's living alone, moved out of her parents' house, and is just really doing so well. And so we have a number of those stories as well, which are really great.
Do you pair the TMS with any other treatment? I mean, counseling and stuff like that, but any drug therapy or anything, or it's strictly?
So if they're already on any kind of psychiatric medications or on antidepressants, we recommend they stay on them. We really closely collaborate with their psychiatrist or psychologist or therapist. Our patients are required to have a therapist before they even start TMS because we're not providing the actual therapy. We're doing the health coaching and other complementary treatments, but they all have to have a therapist on board before they even start because we really believe therapy is a really important part of mental health treatment. And that team approach is really going to yield the best possible results. So we coordinate with their therapist, and if they have a psychiatrist ahead of time, make sure everyone's on the same page. And then we have meetings during the week with that team as well as afterwards to just make sure they have the best possible outcome.
So you're treating a lot of these individual patients, but I also know you have a robust philanthropic initiative.
We do. And so in the course of bringing TMS to, our model of TMS to Encinitas, we've discovered that there is a huge need, but because of the lack of insurance coverage for this accelerated protocol, and even the extended protocol is hard to get covered, we want it. My goal is to really have this available for every single person who needs it and wants it. And truly, I think we can all benefit from it. There's no downside to it. And I've done it myself for mild anxiety and insomnia, and it just helps calm me down, although I'm talking really fast right now, so I don't know how much it's working right this second. I'll stop and take a breath.
There you go.
And so the idea is to have it readily accessible for everyone. If we can all better emotionally regulate ourselves, the possibilities are endless, throughout humanity, really. So one of the areas, there's a couple of target groups that we've focused on who are really in need of this therapy. Veterans, first responders, and at-risk youth right now are the people that we're focusing our philanthropic initiatives and collaborating on. So we have up until, as of right now, I'd say we've done about almost $1 million in in-kind services for veterans and first responders in our community to provide TMS to them pro bono. And now we're working on, we have a philanthropic initiative called Kind Cares. And through that, we are working on delivering TMS services to more of those more vulnerable communities that may not have the ability to pay for the full treatment. So that's our goal. So really, as much as we're doing the paid treatments, we're doing as many, if not more, of the philanthropic treatments as well.
How are you getting funding for that?
That's a great question. So we have a foundation. We're set up through on our website. You can donate to that specifically to Kind Cares, and then we're also doing a lot of grant applications, and we're also partnering with other independent nonprofit organizations who are paired with those particular populations, like at-risk youth and former foster youth. Promises to Kids is an organization here in San Diego that we have a great partnership with. And they identify some of their members who could benefit, and then they come up to our office. We do an extensive intake, determine if they're a good fit, and if they're not, and they need some psychiatric intervention, we can also provide that for them to help get them to a place where they can be in a space where they can receive TMS and have a successful outcome from that. And so we've had some good results from that as well, which is great.
Yeah, that's really wonderful.
Yeah.
So mental health, of course, still has a stigma. I mean, after all this time, and even though you have celebrities and royalty and whoever else talking about it, there's still a bit of a stigma. So how can, let's say from a business perspective, how can an employer help an employee navigate, support, address their mental health challenges or needs, and if that's even appropriate?
I think it's tough it depends on, I guess it depends on the workspace. In our workspace, that's all we focus on.
Right.
So it's kind of a natural progression. But I think, recognizing that mental health is as important as physical health is really important for employers to look at and be aware of. If someone's struggling with a mental health issue, it's almost more overwhelming than a physical ailment can be, as it just really colors their whole world and affects so much about how they're functioning. So I think just recognizing that and giving it the attention it deserves, allowing people to have the time off necessary to deal with those issues, and then providing a workplace environment that is conducive to positivity and a good mentally safe space for people is also equally important.
Yeah, I agree. I think those mental health days are truly really needed.
Yeah,
and
exactly.
more than a day.
Exactly.
All right, and so, I mean, TMS sounds so breakthrough, although you said it's been around for years. Is there something on the horizon in that treatment category that is exciting to you, or?
I think, in and of itself, that is such a novel treatment. For us, the importance of getting it out there and getting people educated about it. Even physicians and healthcare providers don't know enough about it to even recommend it. So my mission is to just educate, and have people know more about it, ask questions, and just recognize.
So are you going out knocking on doors saying, "Hey, I got this.
I got this"? No, I'm going on podcasts and just, anyone who will listen to me, I'll talk about it. So, it's just really getting the word out. We just are doing a lot of outreach as well.
I mean, there doesn't seem like there's a lot of downside.
There is no downside, which is the crazy part, and it's really a matter of cost and access.
So do you think the insurance companies will eventually come around to the idea that mental health awareness is something or mental health care and treatment is something that they really should be covering?
I certainly hope so, because this is such, in terms of efficacy and safety, there is nothing better than this. But there's a lot of I'm sure there's a lot of pressure to keep the medications out there. Mm-hmm. So big pharma might push back against this. But I'm hoping eventually this will be something that will start to become, take hold. The TRICARE and the VA, they have the best insurance coverage for this, which is great to see, because that veteran and active duty population really, they need a lot of help with this. And so hopefully more insurers will adopt some of their policies. But we're also working within the VA and other veteran services organizations to kind of do a lot of pilot projects with veterans and first responders as well, to kind of show okay, this is what works, and sort of bring it to the highlight or spotlight, so that those powers that be can really push for insurance change. Mm-hmm.
I know, because it's been the first responders, and I'm making a big generalization there. It's very much, you feel like, well, I can't. There's a sign of weakness if you actually admit that you are struggling a little bit. And that's probably across the board, though.
Yeah, absolutely. For a lot of people, particularly men, not to generalize, but a lot of men really do feel like it's a sign of weakness. But what I tell all of my patients, it's truly quite the opposite. It's a sign of strength if you can come to a place where you need help, and you're taking a positive step to get that help. Oftentimes, instead, people will turn to alcohol or drugs or smoking or anything. anytime you're engaging in any of those behaviors, you're typically self-medicating an underlying mental health disorder. So, it's kind of something that is hard for people to recognize, but the fact that you want to come in and get treated and get to a better place is a huge sign of strength.
Yeah, I agree. Anything else that you want to share, and where can we find out more about Kind Health and TMS?
So our website is kindhealthtms.com, and you can follow our website is kindhealthtms.com, and you can follow us on Instagram and Facebook, I think. I'm not really sure, but also
sure you
Kind
are.
Health TMS. I'm too old for those things. I don't even know.
Oh, well, it is a wealth of information. And anyone really who has a chance to go visit Dr. Nanos and even spend some time at the practice, you really do have a great team. Whatever your situation is, whatever you're looking for. Like you said, you're a concierge service. You provide this mental health. You provide a village to support and make sure people are in their best place.
Yeah, that's how we want people to feel when they walk through the door. It's not just like you were commenting on the way the office looks. It's meant to look like a cozy home.
Mm-hmm.
We want patients to feel like they are welcome, that it's a non-threatening, non-judgmental space. It smells good, it looks good. We offer you water and drinks, and not alcoholic drinks, but like maybe later in the day. So I'm just kidding. And we just try to make it. Our team is very attuned to everyone's needs that walks through the door. We just anything that comes through the door, we want to just support you and love you and surround you in kindness. We take the kind part of Kind Health Group very seriously. We want I want our patients to feel that kindness. I want my team to treat each other and themselves and our patients with all the love and kindness possible. And I really feel like that's really our core value, and we try to put that out there as best we can.
It radiates from you. So we appreciate your time today. Thank you so much.
Thank you so
for
much
sharing the information and Mental Health Awareness Month, but really it should be every day.
It should be, yes. So it's really important to care for yourself and put your needs first, because that's the only way you can take care of all the other people in your lives. So definitely get out there and do something for you.
Thank you. Thanks for tuning in, and thanks to our sponsor, Max Lux. Join us again for the next episode of Encinitas Chamber Chat Live. For more information on the Chamber and its activities, please visit encinitaschamber.com.